Hello everyone. It's great to see so many people online for this hugely important discussion around EPTRI, and paediatric networks. And what I'm proposing today is a discussion around the platform for a new European paediatric MedTech network within EPTRI and EPTRI as part of the roadmap, and to give you my experience from the UK in the development of the National Institute of Health Research Children and Young People MedTech Cooperative. Next slide, please. So where we started was some years ago, going back to 2014. So in a similar way to Carlo presented his first slide, one of the areas, we realized there were a number of areas of challenge with pediatric technologies. The first of this was around fragmentation, that there was a lot of pediatric technology development taking place that we were aware of, but it was highly localized, and most of the time that was being spread to within hospital trusts or perhaps regions and no further than that. One of the other issues was the repurposing of technologies from adult technologies with quite unimpressive effects and in some cases complications from those technologies. There is also a perception from industry that pediatrics is a relatively small area to invest in child health technology development. And in fact, you know, in the UK, we have a population of about 15 million children and young people, many of whom are well, but actually we are thinking about the prevention agenda as well as, you know, treating those with long-term conditions. And one of the other challenges, and I think this separates out technology development from medicines development, is the research infrastructure is different. We work on innovation pipelines rather than research from basic through to translational to clinical research. The research framework is relatively slow compared to technology development, where in fact that has to be rapid in relation to what industry requires, otherwise the technology becomes outdated. So we needed a new network to try and support the development of child health technology and medical devices. And I brought a number of organizations together to develop what's called the TICH network, and this was the start of our journey. TICH network is a UK or English network. It's Technology, Innovation, Transforming Child Health. And this rapidly became a national network dedicated to transforming child health through technology and innovation. And actually it became a very successful network in a few years. So within a few years, we had worked with funding bodies throughout the UK and managed to leverage over £6 million in funding for child health technology development. Next slide, please. And how we achieved that was relatively straightforward. So I think the first thing to say is when we were working with our colleagues across the UK, there was a real appetite to focus on technology development. There was certainly a lot of adult technologies around. Hospitals were developing technologies, but there was no understanding of how to spread or adopt those technologies in different centres. So we needed a network to do this. And as we formed the network, our first question was really around unmet need. How do we identify unmet needs amenable to technology development and would attract funding? And so we brought together a number of people throughout a series of workshops to define those unmet needs, and that included children and young people as well. And you can see some pictures from those meetings that took place. And we ended up with categorizing over 100 unmet needs, and we then worked on identifying commonality between some of those unmet needs and came up with a priority area, which was around self-care and independence for children with long-term conditions. So this was a funding call that we worked in collaboration with NHS England through a funding call called the Small Business Research Initiative that led to this funding call that was divided into remote monitoring and self-management. And through a series of phases, this led to £4.1 million of funding for the development of technologies in these paediatric areas. Next slide, please. And then came the next step, which was that we applied to the National Institute of Health Research, which is the major research body in the United Kingdom to support research across multiple different domains, primarily divided into basic, translational, and clinical research. But there's also a focus on health technology as well. So in 2017, we applied for funding to become the NIHR Children and Young People MedTech Cooperative. And the way we presented this to NIHR was to focus on technology development in 7 different thematic areas. So you can see those on the left and right hand side. These thematic areas were in cancer, respiratory and sleep disorders, surgical technologies, rare diseases, epilepsy, movement and muscle disorders, long-term ventilation, and transition, which is clearly the movement of children from paediatric to adult healthcare. And we now have an 8th theme, which is neonatal technologies. And this network is led by me at Sheffield Children's Hospital, but we work on a consortium basis. So we have partners throughout the country, with key opinion leaders leading each of these themes, and each of those themes developing projects to focus on technology development in these areas. And we work with partners across the UK and internationally to work collaboratively to develop technologies in child health. And we also have a strong relationship with industry as well. Next slide, please. This is our team. So I'm the director of the NIHR Children and Young People MedTech Cooperative. We have three project managers. We have a business development and project manager and a program manager. And then on the right-hand side, there are theme leads. And in fact, we've expanded our number of theme leads over the last couple of years. Next slide, please. And we're actually part of a larger consortium, which are called the NIHR MedTech and In-vitro Diagnostic Cooperatives, or MICS for short. And these are these have been developed through NIHR to support the development of technologies, health technologies, and in vitro diagnostics in different specialty areas. So the NIHR Children and Young People MedTech Cooperative, which you'll see on the right of your screen there, hosted by Sheffield, is the only paediatric medtech consortium in the country, but we work collaboratively with those other medtech and in vitro diagnostic cooperatives to support technology development in child health. Next slide, please. And we've recently published our biennial report, and it's a complex slide here, but I just wanted to highlight a number of different successes over the last 2 years. So the numbers have clearly increased since we produced this report, but at the time where we put this report together, we had delivered 45 conference presentations and showcased at 22 different events. We have NIHR MedTech Twitter, where we have over 1,000 followers. We had identified 114 unmet needs through the thematic workshops that we delivered. We'd established 178 partnerships, and those were across academia and industry, and that's with small and medium-sized enterprises, startups, and the multinational corporations. We were working at the time of publication of this on 60 different projects, and we had 3 PhD students supervised. So you can see that we have a focus on industry partnership, on identifying unmet needs, on dissemination and adoption, on collaboration, but also education as well. Next slide, please. And we take a user-centered approach to innovation and technology development through the integration of patients and their families with the collaborations that we establish between academia, industry, and health. And we have an ethos that we work to, which is health technology designed for children, with children, and right the way through the innovation pipeline, from proof of concept through to commercialization and adoption, we ensure that patients and their families are involved in those technology developments. Next slide, please. Next slide, please. So, from a platform in which we've developed a network for the development and adoption of child health technology in the United Kingdom, one of the proposals I'd like to make is to potentially build a new European technology network for child health within S3 and EPTRI. Next slide, please. So my starting point for creating that network would be around creating a framework which would support the network development. And it works on 4 different areas of capability. So structural capability, who would be involved, process capability, what's required, relational capability, how do we do it, and strategic capability, why we do it. Next slide, please. So I'm going to divide each of those 4 sections into more detail. So firstly, to start on structural capability. So what I perceive that we would need to do is develop what I've called a 3-dimensional network CV, which is to understand the scope of institutional expertise across Europe, right the way through the innovation pipeline, from proof of concept to the point at which we see commercialization of technologies, diffusion and adoption. And by 3-dimensional, I mean that we are looking across the innovation pipeline, but at each point of that innovation pipeline, we're looking vertically at the area of institutional expertise across that innovation pipeline and the specialty area which they're focused upon. And what we need to do is identify those centers of expertise around what I've termed the 3Ds: digital, devices and design. Now, of course, this is a relatively broad brush approach to doing this, but I want to ensure that we encapsulate digital and data, that we focus on devices, but also there is a design element to the network as well that brings together those that perhaps would be otherwise perceived as peripheral to this, but will be fundamental in areas such as co-creation and co-design, and also the development of technologies to the point of commercialization. Next slide, please. So moving on to process capability, and in terms of what we need, primarily this is around defining unmet needs. And once we have an idea of our institutional CV and those institutions that would like to be part of the network, we need to define the unmet needs across those European centres to be able to define common needs, common themes. And then I'd propose a series of workshops based upon those unmet needs and common themes to define future work streams. And essentially what we then need to do is collate those unmet needs with the capabilities that have been proposed through that institutional CV. So essentially what we're doing is mapping institutional capability to the areas of unmet need to define collaborations, which could then go forward to support projects in these different work streams and to identify funding streams to support these. And underpinning all this is the need for education and training, that we have education and training for those that wish to work in the field of child health technology, and also education and training around the regulatory framework and requirements for child health technology development. Next slide, please. So moving on to relational capability, how we do this, I've split this into 5 different areas. So we need to establish a roadmap for funding the different work streams to support the development of projects around unmet needs. We need to develop a solid governance structure that will include a young person's advisory group. What we need to ensure that the work of new European Child Health Technology Network integrates with EPTRI, and those work packages integrate with the broader work packages and the TRPs across the broader EPTRI framework. That we ensure that there is centralized coordination of each of the work streams with key performance indicators to ensure that we deliver according to timelines around those work streams. And within our work, that we understand the commercial opportunities by working with our colleagues in industry, and understand how we establish readiness for commercialization of child health technologies across Europe. Next slide, please. So underpinning all this will be a network framework which will be supported by a plan that maps out strategic aims that are set out in the short, medium and long term, that will be supported by a number of different strategies and plans. So we'll have a governance plan, support network delivery, a research strategy which is clearly required to support the work streams that are set out, a communication strategy given the broad number or the great number of institutions that could be potentially working within this network, and also broader still, the vast number of stakeholders that could be aligned with a European child health technology network. And underpinning this is the requirement of a commercialization strategy and industry delivery plan in the way that we can move from developing technologies to commercializing these technologies to ensure that we're able to support industry rollout across Europe of specific technologies in different areas. Next slide, please. So thank you for your time, ladies and gentlemen. Just to summarize, I'm proposing through the discussion later on, aiming to develop a pan-European child health technology network, that there is a strategic framework fundamental in defining and developing the network, that we, sorry, can you move back please? The governance structure required to ensure operational delivery, and that we align this alignment of expertise with the unmet needs on that funding and a funding roadmap across the innovation pathway. And that we adopt the ethos of user-centered innovation through true participation that will involve patients and their families. Thank you very much.
Thank you, Paul, for your excellent presentation. We are, of course, as you know, very, very interested in working together to create this child health technology network. So we will plan, of course, further in-depth discussion on this.